Hey guys, so today we're going to do a little full face assessment and kind of walk through what we see and how we can go about treating this beautiful patient. So Lex initially came in and talked a little bit about what your concerns were.
Yeah, so my forehead, and then my 11s right here, and some lower face sagging, I guess, and then a little jawline sharpness.
Okay, so essentially these are the things she came in with, and we always do like a full face approach. So if you get a little bit closer, we'll show you how we'll map out her anatomy. So you can see here with Lex, she doesn't have the traditional 11s. She just has that one singular line, but still you can see how much her muscle pulls. So squeeze again, as hard as you can, squeeze. And so we really want to make sure we're treating the glabella, and we talked about this. She feels like her eyes are a little bit, I guess, heavier. And so this will help kind of lift open the eyes as well. And I've marked these out so you can see, squeeze for me, where the end of her corrugators pull. So you can see how the skin starts to kind of pucker. This is where we're going to want to do like a superficial injection technique versus being deeper, 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 which I'll walk you through that when we actually do the injections. Raise your eyebrows high to the sky. So you can see here, her frontalis muscle is very strong, and it's almost like she has a bifurcated frontalis. Everybody has a different type of frontalis muscle, so you wanna make sure you're not doing a cookie cutter injection. I like to stay really high on my patients for the most part because we don't wanna drop their brows. And tell them a little bit about that one time you had Botox. You said you felt like it was just...
Yeah, I felt like my eyebrows were like raised and it felt really tight in my forehead.
Like you couldn't move it.
Yeah.
And when she showed me pictures, what looked like happened was this part was dropped pretty low and then this was lifted pretty high. So, you know, for her, we're gonna go more conservative. Initially, when I looked at her frontalis, I would want to do more units than what I'm going to do. Because if you look at her frontalis, raise your eyebrows high, you can see it's a very thick, strong muscle. But if a patient ever had a time that they didn't like, or they felt like their Botox was too heavy, or that it made their eyebrows weird, you would much rather err on the side of caution and be conservative than to overload them, because you can always bring them back and touch it up, can't take it out, okay? So we'll go a little bit lighter in her forehead and we'll stay nice and high. Now we're moving on to the crow's feet. Do a big smile for me. So you can see here, she doesn't have a ton of movement of her orbicularis oculi muscle, but still has some, and we do want to support that brow and give her a nice little lift. But what she pointed out to me really was this area right here. And so look up for me. We'll do a little bit of tox as well in what's called that jelly roll. So do a big smile. You can kind of see it right here. This will help soften that area. Now, I'm very realistic with patients, and I explain to them that this is one of the hardest areas on the face to treat is that under eye area, and you're never going to have a perfect under eye. But doing a little jelly roll tox in the right candidate, somebody that has good skin turgor, encouraging them to use retinol, sunscreen, do microneedling, PRF, those things will help support that area as well. Moving down, again, full face. This is not an area that she mentioned, but we kind of chatted about this. So if you notice on Lex, she has beautiful face structure. She's got beautiful cheekbones, good jawline support. But her chin, she does have a little bit of a cleft. Now, some patients love that, and we talked through that. You know, some patients, that's their grandpa's chin, their dad's chin, and if you love it, I never want to tell you to change it. But if it is something that bothers her, we can put a little bit of dermal filler in the cleft to kind of smooth out that divot. It's never going to go away, but you can definitely improve it. Moving over here as well, you can see when we kind of collapse the tissue, how it buckles. So she'd be a good candidate for a little bit of filler in that pre-jowl sulcus as well as like the chin shadow. Moving to this area, she talked about wanting to kind of slim her jawline. When I look at her, I really think she has a nice jawline, but she said she has kind of had some fluctuations with her weight. So I always tell patients, you know, what is your goal weight? And the reason we want to know that before we do filler, you want to make sure you're close to where you want to be weight-wise. So what we're going to do today for her, we're going to Botox her superficial platysmal bands, which is kind of like right along here. Do a big smile for me, as hard as you can smile. So you can kind of see when you smile, the lower face kind of pulls down and it loses that jawline. So doing a little bit of tox in that superficial platysmal band is a way to kind of elevate that lower face. We're gonna start with that, and then we'll bring her back in a few weeks for a follow-up. And if she decides that she wants a little bit more sharpness, then we can do a little bit of radius in the jawline.